Hey everyone, Tim Maria here live in studio at the Digital Health Summer Summit in beautiful San Francisco. We have Brad Thompson, who is an attorney with Epstein, Becker, and Green.
Yep. I practice medical device law. I help folks comply with FDA and represent some coalitions trying to improve policy in the area.
So the topic was Get Smart, Strategies and Sound Decision Making, and it's really an interesting space. So what was happening inside on that panel?
Well, we were talking about the future, kind of what FDA is going to do from here. Last September, they published a guidance on regulation of mobile health. What I was trying to share with the group is that they're not done. They've got 3 more important guidances that they're hoping to release by the end of September, which is just a few months from now. And we're talking about the fact that they're going to regulate or define the scope of what accessories they regulate, so things that plug into the cell phone, that's a big issue. They're going to try and draw the line between wellness and disease. Wellness they don't regulate, disease they do. And then they're going to talk about this interesting topic of decision support software. Software that does the analytics and basically says, Brad, you have a migraine. It literally either diagnoses or recommends a specific treatment for me. So those things are all teed up, and we're going to see those, I suspect, later this year.
So what do people do? How do you remain in compliance or at least have a roadmap in this uncertain space?
Yeah, so there's a lot of companies that are living in that gray area between what is clearly regulated and what is clearly not regulated. And right now, I'm kind of advising them to hedge their bets, quite honestly. There's some less expensive stuff that they can do right now that if they waited would actually be much more expensive. So my recommendation there is there's certain elements of the quality system, incorporate them now when it's cheap to do so. That way you've got it. And then wait and see what FDA does before biting off the more expensive stuff.
Does this impact startups differently because of their cash flow concerns?
Well, absolutely. Startups have to be very careful about how they spend their money. And so what I'm suggesting is, do the simple stuff that isn't very expensive, conserve the cash as best you can, and hope that we get that clarity pretty soon.
What were some other topics that were hot inside?
Well, on the panel, we talked about other issues like if there are benefits to a quality system. And the fact of the matter is, FDA didn't invent the quality system. They went and borrowed it from ISO and other groups that had developed over years, procedures for how you make a quality product. So actually, most of what has to be done is stuff that companies ought to be doing anyway. It's kind of the 80-20 rule. 80% of it, they ought to be doing anyway. The other 20% is documentation. And frankly, companies in this space are really good at documentation, right? That's their business. Information is their business. So capturing, holding, and so forth, that information, they might find easier than a lot of companies.
It's interesting. We're just putting out content. Everything has to be reviewed over and over. And so how do people get in touch with you?
Well, I'm pretty easy to find on the web. If they go to my law firm site, Epstein, Becker, and Green, they can find me on that, and my phone number and everything is on that site.
Okay. So we're going to go into the next session, but we want to thank you for your time. Cheers.
Thank you for including me.